The left side. This is the time at which the technique of choosing the hands for the corresponding side for each part of the body is taught to the student. E.g., being on the right side of the subject, for massaging the lower back and buttocks the right hand will be used since the massage is traditionally started from the hip of the subject and progresses on to the lower limbs first. When progressing on the torso on the right side, the left hand will be used in a predetermined method. Then the student will go to the left side and start doing the massage using the left hand, and this will form the first phase of training where the use of each hands are taught to the student. It is to be noted that, the type of strokes to be used, the amount of force exerted, and using of vayu in focusing and controlling the massage is taught and accomplished by the student during the various stages of training lasting almost a year. The student will use both hands to massage the torso and head standing in a low Kalaripayata posture, focusing and balancing his center in the navel region. This method of massaging is physically very strainful and will require the physical training in various deep postures of Kalaripayata already introduced to the student. Then the subject is made to turn around and lie on the back. Once the subject is on his back, as the massage progresses, a part of massage only for the head and face will be taught separately using head oil decided earlier. Traditionally 2 or 3 students are selected as subjects to be massaged and only the hand is used while massaging so that the student can by heart the stages and pattern of massage. After a gap of 1 week or so, another subject who is older and of heavier build is selected and is massaged by the student. By this time, the disciple will be familiar with the method and pattern to a certain extent and will accomplish the technique of executing the hour-long process of the massage with less and less physical effort and more control and fluidity in the execution of the massage with the use of breathing. After this, 2 or 3 full-grown adult students are selected and the student will do the massage under the physical supervision of the master, who will constantly monitor and correct the technique of the student. Once the master is satisfied with the student's ability and skill in doing the massage with his hand, he is then introduced to the foot massage system, also known in the regional language as Kaviti Ulikil. The subject will again lie on his chest face down and the student doing the massage hold suspended ropes for support, starting the foot massage from the hip with the right foot and altering the legs and strokes for the different parts of the body. The foot massage system, which even though is similar in technique of Kai Ulikil system, demand a completely new set of skills to be mastered by the student, as he will be using the sale of his right and left foot to do the entire massage intertwined with the use of hands for the chest and the face massages. Typically, the force which can be applied in Kaviti Ulikil, compared to the Kai Ulikil, is about 3 times more, and a very physically fit and trained body with absolute control and centering is demanded from the student in successfully learning and executing the Kaviti Ulikil. Neuro. It is to be noted that these Ulikil process are not massages in the general sense and are not to be considered as a treatment to any particular medical condition. This is taught as a process of learning and accomplishing skills in the Ulikil system of Kalaripayata, which works as a whole-body deep tissue stimulation and intoning up of the musculo-skeletal, muscular structures, improving circulatory efficiency and correction of any acquired physical injuries or ailments of the body of the person being massaged. The Kalari Ulikil system is designed in such a practical and technically perfect manner, such that the circulation is stimulated away from the heart and according to the muscle structures of the body, which is massaged in a very scientific and fluid manner. In later stages of the clinical practice of the physician, specific parts of the body suffering from an ailment can be treated with various types of Ulikil or Kili poultice treatments, where the accomplishment achieved in the whole body massage training can be utilized effectively. As it involves deep tissue and circulatory stimulation, the Vipathya, advised for Snehapanam in Ayurveda, is advised for the Kalari massage also, with strict regimes of food, brahmacharya and other restrictions for the period of massage and a similar period following that. A purging of the digestive system is particularly insisted on the 8th day morning to clear the kostha, in which the dislodged dosa or toxins generated by the stimulated circulation and breaking up of adipose tissues accumulated during the massage. A practical hands-on training and learning of Marma practices of northern Kerala, the Marma system in Kalaripayattu, is different from the classical description of the marma in the Susruta Samhita and other similar texts. As the Kalari marma are taught as part of the learning of martial practice and is often studied as a practical hands-on training, they contain detailed inscriptions of the location of the marma, the measurement of the actual marma, the part to be used to access that marma during the application, the effect of the marma application, and finally the Marukai, or counter-application to rectify the damage caused by the marma, often giving even the time frame within which the Marukai has to applied, etc. In advanced training of the Kalari student, the practice of Adakal, a unique curved wooden weapon exclusively found in the northern Kerala Kalaripayattu lineages, which also contains attacks and defense techniques to the various marma points, and the training in Viram Kai, or bare hand fighting practices, which include special moves and techniques to inflict injury to the marma points, and is traditionally taught by the master after following special initiation rituals and often in secrecy. Specifically, in the Kalari practice the marma points are further classified and studied as follows. Kula marma, they are marma points which can cause death when injured. Kaku marma, they are marma points which causes internal hemorrhage and can make a person unconscious and in some cases can cause death if left untreated. These marma points are described as a set of techniques involving attacking and defending moves, etc. Abhyasa marma, they are marma points which are used in the practical applications of Kalaripayattu and can cause temporary paralysis or disability. The understanding, identifying and application of the marma points is used in the Kalari system in a dual manner, where the identification of marma and inflicting an injury to the marma on one hand and on the other hand in a reverse order, understanding from the laka, the marma involved, and doing a Marukai to revive the person from the disturbances caused by the marma and treating it, to cure the person of any damages the marma injury must have made. As explained in the documented marma points, the measurement methods followed by the northern Kalari lineages are explained below. Measurements: there are two types of measurements: 1. Angula and 2. Viral, also called viral. Angula, as per the Kalari tradition, 1 angula forms 1/8 of a padam or 1 foot or ADI. 1 angula equals the length of the first joint to the tip of the thumb of the person. Viral, 2 viral is equal to 1 angula. Viral is the width of the index finger. 16 viral will form 1 padam. The typical description of the marma will identify the point by saying the name of the marma, often in unique Malayalam names like Panam, Koksaram, etc., and will mention the location, such as, there exits 1 marma of such name, for viral, fingers, from the Nensan Kuli, junction of the chest. It will next say the result of an injury to that particular point. Like, when thrust with the index finger, the person will open his mouth wide and gasp for air and may faint afterwards, and then the Marukai or counter-application to be done to revive the person from that injury is explained. E.g., Marukai Pinparatu Tola Lukal Tadi Bottom Varutika. Counter-application, tap at the back in the interscapular region to revive and regain consciousness. It may also mention the duration within which the Marukai is to be done, otherwise, the result of not doing the Marukai is also mentioned. Both in the Kalari and Tamil traditions the marma are taught to the student as a hands-on teaching, both inside the Kalari and in the treating center of the Gurukul. The direct reference of marma to the Kalaripayattu masters is derived from the handwritten manuscripts, and they are often in Malayalam with a Tulu or Kannada dialect in the language used. An example of a description of marma point in manuscripts is as follows. Translation: in the depression of the throat above the thyroid cartilage is a marma named palm. It is 2 angula long. Attack with index finger and mouth will open, vomit blood and become unconscious. Remedy: make the person conscious again by tapping at the depression on the back side of the neck. The depression above the prominence of trachea is the location of panamarma. It is 2 finger breadth, and injury to this marma is caused by hitting it with index finger. Injury to this marma causes opening of mouth, hematemesis, and loss of consciousness. The Vamakukai, correction, for this injury is tapping over back side in between the shoulder, to get back the consciousness back. Application of the Kalari marma tradition in the clinical practice of a Kalari physician or Kalaripayattu teacher. In the clinical practice of a Kaloripayata Marma practitioner, the Marma system may not be used to treat day-to-day clinical injuries like a sprain or a muscle in spasm or a fracture. But in special injuries which NTS itself as a Marma injury showing the presence classical explained in the 3 types of Marma. Symptom injuries would be identified and the prescribed Marukai will be applied by the physician before following up with the treatments required to prevent long-term damages, along with the various types of Bant types. In general, the clinical practice of Kaloripayata involves well-treating sprains, fractures and dislocations as neuromuscular conditions like muscle spasms, and many degenerative neuromuscular conditions involving the macron or the nervous system. By using the Ulical system as the primary method of treatment, especially beneficial in acute conditions, Pradesika Prak, regional, Kili treatments and massage therapies are utilized along with specialized medicinal formulations of the Sampradaya to treat varied day-to-day clinical and chronic orthopedic and sports-related ailments. Like not of several lineages have perfected the techniques treating soft tissue injuries like sprains and contusions effectively, with the use of bandages and massages. In chronic conditions, these treatments would involve different types of Pradesika, regional, Kili treatments, Manjalkali, and Ilakili, etc. In general, Kaloripayata systems follow the Panchakarma systems of Sadhana Sikitsa, other than the seasonal whole-body hand and foot massage called Kalari Ulikal, which is normally done to a Kalari student or a healthy person as an annual overhauling of the body for a period of 7 days during the monsoon season. In Kalari treatment systems, different methods of reduction of fractures and dislocations are practiced, which is followed by use of medicated bandages using Thailam or Marma Galika, with some local variations. Of these, special bandaging of the ankle joint and foot injuries, the knee, elbow, wrist and shoulder using different types of splints made out of palm fronds and bamboo to immobilize the bones and joint requires special mentioning. Mainly 2 types of Kili are used in Kaloripayata system. Manjakili has 7 medicinal powders in a special combination with Manjalpudi, turmeric powder, being the main ingredient, hence the name Manjakili. In treating Marma of injuries involving the actual Marma where the primary Marukai has been applied and the patient revived, Manjakili is often the final treatment given to clear the blockages of Vayu and to prevent hardening of tissues. It is also used in treating many types of hardened inflammation like post-immobilization stiffness of a sprained ankle or knee joint and in rehabilitation fractures and also in treating chronic spondylitis of the spine in both cervical and lumbar regions. Ilakili of Kaloripayata has leaves of 14 plants slightly different from the classical Lakili of Ayurveda, and they are finely chopped and dried in a special manner so that the same can be used in any season and time. Application of particular oil selected for the treatment is applied prior to and after the treatment. Ilakili are used in Kaloripayata for treating with macron vikara, and also in rheumatic, arthritic and degenerative conditions. Pharmacological use of different medical formulas in the Kalari Marma practice. One specialty of the Kaloripayata is the use of specialized medical formulations refined by the tradition over several generations of hands-on practice. As mentioned earlier, even though the Kalari system's medical practice and pharmacology originated from Ayurveda, the system uses many traditional yoga handed over by several generations of teachers. A brief list of such special Kaloripayata yoga are given below. Thailam is similar to Katantaka Muravena Ayurveda. The which is widely used in yoga differs from Muravena with addition of few ingredients. The Thailam is used in Kaloripayata for muscular contusions as well for bandaging in fractures and sprains. And is Melyuga Thailam is based on the classical, Pinda Thailam, yoga of Ayurveda. Kaloripayata physicians use this oil for massages and bandages. The conventional Pinda Thaila yoga is improved and altered in a significant way used in Kaloripayata as Melyutalam for treating rheumatism, also in reducing inflammation and post-immobilization stiffness. Melutalam is often the first line of treatment in marma injuries like Kirka marma injury of the foot and palm, where persistent swelling and redness with throbbing pain results from lymphatic blockage. Mon Thailam or Siddhartha Thailam is a special formulation of MARMACIKITSA lineage similar to Monria Thailam of Ayurveda formulary. However, the formula is modified significantly by the experienced Kalari Vaidya of previous generations with a different Kalka and Svarasa. It is effectively used in all NA with Macron Ragas, especially chronic spondylitic and degenerative changes of the spine, and in treating sciatica, nerve injuries and radiculopathies. Ilakili is done with this oil, and the same oil is used to massage the body immediately after the Ilakili treatment. Kalari Mukit, the Mukit, combination of 3 oils, of the Kalari system is an adaptation of Ayurveda Mukit concept of using 3 oils, but significantly different in using Svarasam of 3 leaves and wide range of Kalka of 36 medicines. This Mukit is used in Kalari Ulakil. Mukit strengthens the bones, joints and muscles. Marma Galika, the Marma Galika of the Kalari system, which is having Senanaicum, dried aloe vera gum, as one of the ingredient, is used similar to a puck, lepum or paste, but in a different way, where it is ground to a fine paste in egg white and rolled in bandages to immobilize fractures with splints in the final stages of union, as it acts as a medicated plaster with bone healing properties. This type of bandages is used typically on the 3rd or 4th change of bandages or after the swelling subsides, and is left for a prolonged period of 5 to 7 days, which helps in healing of sprain, contusion or fracture. Some special yoga like Jivaniya Thailam for head injuries and Bhadratalam for Kadinji and Pinasam. Katusnam, combination of 4 Sneha, similar to Pankasnaha, combination of 5 Sneha, of Ayurveda system with a modified Kalka, Svarasa and Kayam, is used for treating periarthritis, frozen shoulder, and muscle wasting. Galika like Ajalyati Galika, which is used in treating Vayu Kobam, and a traditional liam called Mkatamtam liam, which is used in treating chronic uricata vikara and Na with Macron Ragas, and in some specific Striroga need special mention as the traditional medicinal formulations followed by the MARMACIKITSA lineages of northern Kerala. MARMACIKITSA, current status present, exact known number of figure as the practitioners of this tradition is known. But it is estimated that there are hundreds of families which have passed down this knowledge in some form or another, and there are thousands of practitioners still in varying possession of this knowledge to degrees. The density of practitioners is especially high in the southern tip of India, especially in the Kanyakumari district and areas such as Nagercoil, where it is a popular saying that each house has a Marma expert. Due to the density of practitioners in this area, this system has maintained the continuity of tradition. There is a need to prepare a catalogue of main practitioners and pioneers in the field of MARMACIKITSA to identify experts in the field and to improve awareness and linkages of these practitioners with the society. In general, the Tamil Marma system is gaining wide popularity nowadays throughout the world owing to a number of practitioners and more individuals and institutions taking interest in the learning, understanding, research and propagation of this tradition. The Kalari system also, due to its Gurukula structure, in the form of numerous Kalari established in various parts of Kerala and Tamil Nadu, has retained the traditional flow of knowledge and has started to flourish after reaching a historic low point during British rule due to persecution from the British rule. Even in Kalari, there are different styles of practice based on regional variations. But the medical application has grossly been limited to the management of fractures, sprains and minor trauma. But in the recent times, it has made notable inroads into the emerging field of sports medicine in Ayurveda and has shown great potential in health promotion of athletes and in better management of sports injuries. Thus this field holds a great potential for the future of MARMACIKITSA. The practice of Marma as per the tradition of Ayurveda, especially the Susruta Samhita, is now begun showing a lease of life after reaching a state of complete annihilation after a few individual practitioners in various parts of the country, based on their personal commitment, has taken up the revival of this practice. But it is still in its nascent state and needs to grow to greater heights to become a part of the mainstream of Ayurveda. The main practices which are currently practiced as a part of MARMACIKITSA include manipulations, massages, bandages along with the practice of Ayurveda, venesection/needle puncture, agnikarma, moxibustion, etc. Thus it has the potential of developing as a new adjuvant therapy to mainstream Ayurveda practice. There is also need to give worldwide reach to the knowledge of MARMACIKITSA so that more and more people come to do research in this field, and the potential of MARMACIKITSA can be optimally utilized in the health sector of our country and also taken to the world stage. A search for the word Marma in the titles of papers published in PubMed database showed just 2 relevant papers, and the search for the word Varmam gave just 1 relevant result. This shows the lack of scientific research into this field, which needs to be explored further. Based on the current published information and inputs from practitioners of MARMACIKITSA, this field has potential to give significant contributions that to health care, especially in fields such as pain management, developing emergency management strategies in Ayurveda, especially resuscitative techniques by using various techniques of Adankal, Tiravukal, etc., sports medicine, and effective management for many pediatric and surgical cases. This science has also the potential to improve the understanding of the human, especially living anatomy, integrated knowledge of anatomy and physiology. Also, since MARMACIKITSA utilizes the body's innate healing potential, it would also be helpful to reduce burden of other chemical and herbal medicines, especially in the context of side effects related to chemical medicines and the availability of herbal medicines. Need for contemporary understanding and relevance of mainstreaming in clinical parlance. It is the need of the hour to integrate the healing potential of various aspects of MARMACIKITSA into the clinical practice of Ayurveda. In order to frame a roadmap for the upliftment of this science and integrating it into the mainstream Ayurveda practice, it is necessary to do an analysis of the main strengths, weaknesses, opportunities and challenges MARMACIKITSA, which are as follows. Strengths. Can be done anywhere, anytime, even without any medicines. Most effective in case of Vadavayati, which are the most difficult to treat by contemporary methods of Ayurveda. Gives extremely quick results. Can be used along with any system of medicine. Has its own theoretical framework, pathology and management strategies, making it a complete science. It can be allied to other Indian knowledge systems due to the common philosophical and fundamental basis. Uses the innate healing potential of the body and thus reduce burden of allopathic medicines and also diminishing herbal resources. Numerous extrapharmacopoeial formulations. Rich literature available but in the form of manuscripts, list of main published books and other publications, attached list of known books as appendix. Helpful in bringing prognosis of disease. More. Mostly painless therapy. Simple to apply. Clarity into the of weaknesses, strict discipline of classical learning. Very few experts available. Dangerous in wrong hands. Lack of standardization of and methods, however, considered as standards. Most of the literature available only in Tamil language. The points, texts. Pressure may be. Needs clear ideas of Sadhyasiddhayata. No much published researches, lack of scientific evidence. Opportunities. Drugless therapy and hence easy to introduce. Useful in many difficult conditions. Area with scope for integration of different IYUSH systems. Strengthens the Salyatantra branch of Ayurveda and also Ayurveda physiotherapy and sports medicine. Panchakarma also can be made more effective. Development of new drug delivery forms can be based on marma, pain sprays, gels, etc. Integration of many modern techniques of resuscitation to various marma practices. Incorporation of latest technologies. Like Carillion photography, pressure measurement techniques, etc. in the study of marma. Exploration of the use of marma as anesthesia in surgical and parasurgical procedures, etc. The logic of many Ayurveda practices hidden in the concept of marma, for example, explaining relation of nausea and strength of shoulder, etc. are. Bringing out innovations in Abhyangam, etc. using the principles of MARMACIKITSA. Bringing out the vast range of technical terminology in Varma and Ayurveda classical literature to light to structuralize panchakarma and massage techniques used in Ayurveda. Hidden aspects of Marma in Ayurveda, Abhyangam, Nasya etc. Challenges. Integration with philosophical base of Ayurveda. Lack of detailed descriptions in Ayurveda classics. Non-availability of other Sanskrit literature on the subject. Differentiation from acupuncture, acupressure etc. and taking clues on how they became popular.